BC has added a single case of measles to a growing list of cases across the country. Infections of that highly contagious disease are rising in some parts of the world. Chad Pawson explains how much risk people here are facing.
BC's case came from a traveler to the province. They were unvaccinated and discovered to have measles when they sought medical attention in the Vancouver area. BC health officials are being cautious.
I think the likelihood of acquiring measles in British Columbia at this point is very, very low. So we don't have a province-wide outbreak. We've had a single importation. Fortunately, it was imported into probably the part of our province with the highest vaccination rates.
The case is tied to the city of Richmond. Vancouver Coastal Health is warning over two possible exposure points. First at the Vancouver Airport Hotel on Westminster Highway, and then at the ICBC location on Number 3 Road. People who are at these locations from February 24th to March 2nd should watch for fever, cough, runny nose, red eyes, and an eventual rash.
I'm concerned about every case of measles. You'll recall in 2019, there were 29 cases of measles in British Columbia, and we took very strong action to address that at that time, including actions that led to the immunization of 38,000 school-aged children.
Officials in BC are using the case to reiterate the importance of being and getting vaccinated against measles, especially as families plan vacations and travel for the March school break.
We should not have diseases that should be eliminated in British Columbia, like measles, flaring up like we've seen in other parts of the world. And also to everybody who's trafficking and misinformation about vaccines, they make us safer.
But how do you know for sure if you've been vaccinated?
Yes, I've been vaccinated for measles.
For measles?
Yeah.
And how do you know?
You know, Mom has the sheet to show.
I guess I am.
You guess you are? How would you find out for sure? Do you know?
It's been a long time, but I'm pretty sure I am.
Yeah.
My mom has told me already about it.
All my children are vaccinated. I know exactly where their vaccination booklets are. But I think people in their late 50s, it's true, it might not be so obvious to know how to check.
If your mom says, you know what, you had all your vaccines as a kid, I know you did, we don't consider that to be the best source of information if it's undocumented. But if you know that for sure you weren't in a vaccine refusing household, then chances are you were vaccinated.
Still, if you are unsure over vaccination or have only received one dose, BC officials are encouraging you to get the jab. That's unless you were born prior to 1970. In that case, you're most likely already immune. Chad Pawson, CBC News, Victoria.
One case of measles has been reported in BC. As the number of infections rises in some parts of the world, it's the first recorded case in this province since 2019. Dr. Iris Gorfinkel is a family physician and clinical researcher in Toronto. She joins us now. Dr. Gorfinkel, thanks for being here. First of all, what measles symptoms should people be watching out for right now?
It starts out looking just like a cold. In fact, the best doctor cannot tell the difference between a cold, flu, COVID. It looks just like that. Runny nose, cough, sore throat, high fever. But then 2 days in, something special happens. Koplik spots. Now, those are spots that develop on the inside of the mouth, and they are unique to measles. So COVID doesn't cause it, the common cold doesn't cause it, and neither does influenza. They look like tiny grains of salt on a red base. Now, those are only going to be there for 2 days because as the rash goes from the mouth, it can spread to the face, to the neck, to the trunk of the body, and then out to involve the arms and legs and the palms and soles. But that rash on the mouth, that's the big clue. 7 out of 10 people experience it.
It sounds unpleasant, and we know that there is no cure for measles. We do have a vaccine. Are there any other treatments beyond that?
Yeah, it's kind of scary because 1 in 5 people who get measles wind up in the hospital. 1 in 20 kids can have pneumonia. So the clock starts ticking as soon as the symptoms start. 3 days into it, in fact, a person can still get vaccinated, and that will reduce the severity of the disease. If it's as late as 6 days, antibodies can be given to reduce the severity of the disease. But it's important to understand, These do not cure the disease. No. We don't have any antivirals or antibiotics that treat it. It's a viral infection. So unfortunately, what we're left with are things like Tylenol to treat symptoms.
Now, with spring break on the horizon, lots of people planning to travel. What are your concerns as we may expect an increase in travel and possible spread?
Yeah, I want you to just imagine those airports for a moment. Crowds of people standing shoulder to shoulder, breathing, blowing their nose on their Kleenexes, then touching railings. Because guess how measles is spread? It can stay 2 hours in the air. It can stay 2 hours on surfaces. And that's how people can get it, breathing it in, touching those surfaces. So that is very concerning. Travel is a reason to ensure that you're vaccinated.
Now, if people are unsure if they or perhaps their kids are vaccinated, what is the best thing for them to do? If they can find the list that perhaps their mom, and blessed my mother for having that list that said I was vaccinated, but what if you don't know?
If you don't know, it's always better just to get vaccinated. The vaccinated safety is very much there. The risks of not being vaccinated are very severe. As I say, 1 in 5 individuals who get measles will in fact be hospitalized. And it takes 95% of us to stop community spread. And as you may have heard, we've already had a case in Ontario of community spread. So it is pretty concerning. So if in doubt, get vaxxed.
All right. Dr. Iris Gorfinkel, family physician and clinical researcher in Toronto. We always appreciate your time and your expertise. Thanks for joining us.
Thank you for having me.